Hi, everyone. I'm Maggie McGrath, Senior Editor at Forbes. Cuts to the National Institutes of Health budget have been one of the biggest stories of 2025. Not only has President Trump canceled nearly $2 billion worth of funding to the NIH and canceled 1,300 grants, there are further cuts potentially in the pipeline. The budget for 2026 calls for a 40% reduction to the NIH budget for 2026. And all the while, the prestigious Nature journal is reporting this week that the NIH is dismissing grant reviewers in favor of those who are sympathetic to the Trump administration. Joining us now to discuss all of this is the new president of the American Association of Immunologists, Dr. Ulrich von Andrian. He is an MD and an immunopathology professor at Harvard Medical School. Uli, thanks so much for being here.
Well, thank you, Maggie, for having me.
I just rattled off a lot of headlines about cuts to funding, cuts to grant reviewers allegedly being dismissed. How dire of a public health situation would you say we're in right now, given this environment?
Well, Maggie, this is a evolving situation. I think we are headed in a very challenging direction right now. I can tell you from my very own example, I have run a research lab for 31 years, and as of 2 months ago, for the first time, I'm without any federal funding, which has resulted in a reduction in the size of my research group by more than half, and in severe cuts to our research enterprise. I'm not alone. There are many labs that experience similar challenges, and we think with the plans that are currently being discussed, this will become even more dire going forward.
Recognizing that you are not alone in this experience, I do want to dig into specifically what's been going on at your lab. You said a reduction in staff. What does that mean for the research that's been ongoing? Have you had to cut full projects?
Yes, so there are several projects that have been going on for more than a decade, in part in my laboratories, where we are trying to understand how the immune system works in specific aspects in the context of certain diseases. And these have been supported by federal grants for many years. It takes decades often to build the expertise to answer the questions that we are asking. And this expertise obviously resides in individuals who spend years developing certain skills, developing understanding in a very specialized area. So when these people can no longer stay in their position because there's no more funding, they leave. They have to leave, and with them, their expertise leaves, which results in a permanent loss of what my laboratory can do after years of funding, and we see that around the country.
That's a permanent loss in knowledge for your lab. It sets back research in a crucial area, the immune system. And I'm wondering, given that you had federal support before, what did the government say to you when these grants were canceled? Is there a reason that they gave in removing this funding?
So the government has said nothing to me personally. I was informed by Harvard University that my NIH grants had been terminated. Harvard, of course, is a special case because there are ongoing discussions between the federal government and Harvard. But I myself have had no official communication from NIH regarding the termination of my grants.
Now, when we talk about these canceled grants, you have the purview sitting as the president of the American Association of Immunologists. There have been a lot of headlines about areas of medicine and science that have been affected. I've seen headlines about sickle cell research, research into cancer medications. What else are you hearing from the fellow doctors and researchers that exist within AAI's purview?
Yeah, AAI is specifically supporting researchers and has its membership primarily among researchers that study the immune system. But the immune system is everywhere, and it affects virtually every major disease known to humans. And this includes cancer, this includes infectious diseases, this includes autoimmunity, neurodegenerative diseases, as well as cardiovascular diseases. In all of these areas, immunologists have made major contributions to how modern medicine is treating or preventing these conditions. And much progress that is currently in the pipeline is likely to be slowed down or may never happen if those proposed budget cuts are coming through.
There was an article in JAMA that I saw that indicated that nearly 99% of drugs that entered the market between 2009 and 2019 had some sort of tie to NIH funding. So you just rattled off an immense number of conditions, neurodegenerative, cancer. Is there any one area of the body or medicine that is more affected by these cuts than others, or is it really just vast and widespread?
So I think when it comes to NIH funding in general, it's really supporting every aspect of human health. And I think maybe the best example to give you here is if you look at the decade from 2010 to 2019, the FDA during that period of time has approved 356 new drugs. NIH support has contributed to 354 of those drugs. That is 99.4% of all approved drugs over a 10-year period in this country that had contributions by NIH funding. Many of these drugs are related to modulations of the immune system or have an impact on the immune system, and in fact have involved immunologists doing research in a large variety of different areas.
So does that research now go into what scientists sometimes call industry? Do the researchers that you speak to, are they talking to private institutions or companies to go there to continue their research versus staying in academia?
Yes, for sure. I see this in my own laboratory. Many of the individuals who had to leave actually chose to go to industry, but industry ultimately gets much of its fuel in terms of novel, innovative information from academia and ultimately from NIH-funded research. So there's a pipeline that starts with NIH-funded, very basic research in laboratories such as mine, where discoveries result in property, in patents, in other technology that ultimately gets licensed or spun out into startup companies or licensed by larger companies, pharmaceutical or biotech. And that ultimately drives a vibrant economy. NIH funding today in 2024 has supported about 408,000 jobs in this country. And I think there will be a great attrition of that going on, not just in academia, but also in industry, if these cuts are going through.
You raise an interesting point about innovations that start in academia but then get spun out into a startup. We see that a lot at Forbes. So could these funding cuts ultimately affect the entrepreneurial ecosystem in the United States?
I think that is very likely. Obviously there are private entities and venture capital or in similar areas that ultimately have to take a risk, have to make a bet on technology that comes out of academia to put up the funds to develop something from a basic scientific observation to a commercialized drug, which can take many years. As these discoveries slow down, investment inevitably will also have to slow down. I think the entire system will suffer from that. And it might be interesting for you to know that every NIH dollar that is currently being invested in extramural research generates $2.56 in economic activity. So if you do the math, right, then a cut of $19 billion, which is currently related, would result by it roughly $50 billion lowered economic activity.
Now, when you mentioned earlier, your lab has decades of research and work behind it. And a lot of this research, it doesn't start on January 1 of one year and end on January 1 of another year. There's a long tail here. So I'm wondering specifically about clinical trials that were ongoing. For patients who might have been enrolled in a clinical trial, what do these cuts mean for them? Do they just stop in the middle of the trial?
How this is handled in individual cases, I cannot say. I think if the funding runs out or is not approved, then the trial either cannot start or cannot continue. There's no question about that. I think there are severe ethical concerns that come with this because the companies or the researchers that enroll patients in a clinical trial have an obligation then to continue treatment as long as the patient is in the trial. So that too will pose a lot of challenges. I think overall a reduction in the number of trial or even cancellation of ongoing trials is bad and will ultimately result in more suffering and unfortunately also deaths that could potentially be avoided.
You mentioned suffering and death. I had been wondering, you look at the sheer number of grants that have been canceled and you look at the areas of research that have been affected. Do you think that these cuts have already caused death in the United States?
I cannot really answer that question. I think there's probably a statistical probability that could be determined, but I don't have any information to speak to that myself.
Now, you have experience running your own lab, but as president of AAI, what else are you hearing from fellow researchers? Are there stories or anecdotes that stand out in your mind about their experience in this current environment?
Yes, I hear from I can tell you when I see my colleagues in the hallways these days, we avoid asking each other how we are doing. We just tell each other that it is good to see them because no one is doing well, given that we have spent our lives building our research laboratories. And this comes with tens of millions of dollars in prior investment by the federal government, right? Because the grants we have received throughout our years have helped us build our laboratories to where they are now. And all of that is now in severe jeopardy across the country. So, and I hear this everywhere where people are telling me that they are contemplating offers they're getting from other research institutions abroad. This also goes to my own trainees, who often are foreign born, who came here hoping to do a career in the United States, but are now looking elsewhere for career opportunities.
Are you or anyone else at AAI trying to lobby the federal government or talk to GOP lawmakers about the effects that these cuts could continue to have on public health?
Yes, absolutely. This is actually one of the major functions of AAI, public outreach. We have even activities to educate the public in questions regarding the immune system in an unbiased and scientific sound manner. We also have connections to Capitol Hill. We are visiting Capitol Hill at least once a year. We have public policy fellowships that we offer to our memberships for immunologists interested in going into public policy. And we also have letter writing campaigns, since we have members in all 50 states in this country, where we encourage our members and provide them with information to talk to their elected representatives.
Now, I know you said that the government did not speak to you directly about grants that have affected your own lab, but in the capacity as president of AAI, have you spoken with HHS Secretary RFK Jr. or anyone from the Trump administration about these cuts?
AAI has sent a letter to Mr. Kennedy inviting an open dialogue, offering our expertise and a constructive collaboration in questions regarding public funding of in research, as regarding questions related to the immune system. We have, to my knowledge, not heard back from him or from anyone in his office.
Now, looking across AAI and all the researchers that encompasses, you mentioned tens of millions, if not billions of dollars have flown from the federal government into this research over decades. We at Forbes see a number of the world's billionaires with at least that much money in their net worth. So are you looking to the private side of the world, folks with large foundations or large personal net worths, and asking them for help in funding some of this critical healthcare research?
We are looking everywhere. Obviously, we welcome contributions by anyone who has an interest in supporting our work. I think this is definitely useful and impactful. I don't believe that private funding can fully substitute for the type of funding we receive from the federal government, in particular because most foundations or even for-profit outfits like companies have a particular agenda. They want to see a certain disease investigated, or they want to develop drugs for a particular indication. So there is funding available, but it is all earmarked, not all of it, but much of it is earmarked to go to a particular ultimate goal. What has really driven the most significant innovation is the curiosity-driven, investigator-initiated research that is uniquely supported by NIH.
The curiosity-driven research supported by NIH. That's true. That's innovation that my mind can't even conceive of. Is there any possibility of hope? Are you hearing any rumblings from contacts in the government or anywhere else that that proposed budget cut to the 2026 NIH budget might get reduced or eliminated entirely? Do you have any hope?
There's always hope. I think by nature an optimist, and I'm hopeful that some sort of compromise can be found that will allow us to continue the work that we have been doing to also maintain leadership of the United States in biomedical research, which I believe we are at grave risk to losing now to other countries if we have not already lost it. And I believe that is in everybody's interest. And so for that reason, I'm hopeful that some compromise, some solution will be found. However, I have had no specific communications by any decision makers myself to sort of hang my hat on some objective facts here.
Before we let you go, is there anything else we should know about the work that you're doing and the work your fellow researchers are doing as it relates to NIH funding and the cuts we have so far seen in 2025?
Yes, thanks for that opportunity. Maybe I should just point out one point that may not be clear to people who never think about how grants are actually being provided. These are not gifts and they are not favors by the government. These are extremely competitive, very hard to get, based on years of diligent work. And they are ultimately contracts between us doing work for the federal government, or actually for the American taxpayer. And that is our view of that, and that is what we have set out to do here. And we hope that we can continue this work because it's to the benefit of everybody.
Dr. Ulrich von Andrian, thank you so much for joining Forbes and sharing your insight. We really appreciate your time.
Thank you very much. Pleasure to meet you.